I've reviewed the physician's orders and I'm performing hand hygiene. I'll shut the door and provide patient privacy. Good morning, my name is Cam and I'll be your acting student nurse today. Can I have your name and date of birth, please? Okay, perfect. Good morning, Ms. Jones. Today we'll be taking care of your dressing, your sterile dressing. I'll be changing it today, and before we get started with any of this, I just want to let you know, do not touch any of my sterile fluid or your dressing to minimize the chance of infection. And also, while we're on this topic, are you experiencing any type of pain this morning? On a scale of 0 out of 10, 10 being the worst, 0 being absolutely none. She says she is experiencing 0 out of 10. If she were to be experiencing pain, I would administer analgesics and then come and reassess my patient after 30 minutes. All right, so now I will be assessing all of my packages for date or contamination. Perfect. Okay, everything is in date and not contaminated. Now I will begin to prep my sterile field. I'm going to perform hand hygiene before I begin so. All right, now we will maintain sterility. Okay. Placing our gauze. I'm going to keep this folded down because we'll be using this later for the water. Okay, so now using water, grab it by the label. Look. Okay, and all the water was used. If it was not used, I would then date, initial. That way, if we were to use it later, they would know who opened it and when it was opened. Alrighty, now I will get that out of the way. I will be donning my clean gloves, not my sterile gloves just yet. Make sure I'm over the sterile field. All right, now I'll be removing our sterile dressing, our contaminated dressing. Okay. Careful to not injure the patient. All right, now I'm checking for the color of the drainage and the characteristics of the wound. All right, the patient is not able to see any of it. And these gloves and sticky tape is just not the way to go. Alrighty. Removing gloves. Okay, now I'll perform hand hygiene. And now we'll begin to don our sterile gloves. Okay, now the right first, step back. I'll go with our left. Step back, keeping the thumb extended. Turn out contamination. Okay, and now that it's sterile, I will readjust gloves. Okay, keeping everything above my waist. Now, I will grab with my clean hand, although both hands are still sterile. Dab it in, transfer it. Starting with the cleanest. Okay, put it away. To the next. Dab. And I'll go to the right side. Down. Finally, the left side. All right, now we'll be drying. Okay, with the cleanest, sterile portion. And to the right again. And finally, okay. Now this is clean. This hand is contaminated. I will now unfold my sterile dressing. Placing it on top. Positioning it. Perfect. Okay. Now I will remove my gloves. Sterile technique. Still maintaining sterility. Okay. Now I'll be donning clean gloves. Tape. Now both glove hands are clean. Now I'll begin to tape and with the pain all four corners. I will go ahead and apologize for the stickiness of this tape. Fold it over on me. Go back to that with the second part of our tape. Alrighty, now all four sides have been taped down. I'll keep my gloves on, and I'm going to clean up my sterile field that is no longer sterile. Okay. Tape. And all of this water was used. Okay. Right. Sterility. Hands. Okay. Now we'll grab this bag and throw it into the biohazard waste bin, like we do my lab. Now I'll perform hand hygiene. I will cover up my patient. Alrighty, Ms. Jones, are you good and comfortable in your position? She says that she is. Now I'm going to lift my side rail up, ×2. Leave the bed in the lowest position. Call bell there beside her appropriately within reach, and bedside table as well. Now I will exit the room, and I will document the appearance of the wound, the characteristics of the drainage, and the patient's response.